Hello again, and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan, and I am an associate marriage and family therapist from Southern California. I currently work in a private practice where we focus on child anxiety reduction, and I also do some work for a nonprofit cancer support organization. This episode will go over some things I wish I knew while thinking about therapy graduate programs. Researching therapy programs was so overwhelming for me. There are so many options on what to do in this field, what type of degree you can get, and it is all so confusing to research. Right now, I'm going to clue you in on little hints on what to look for while researching graduate programs, information about the application process, interview tips, and more. So first off, why this field? Why are you thinking about going into the therapy field? Do you have a personal history with mental health? Have you been in therapy yourself? Have you worked in a clinical setting? Do you just have an interest in psychology? It is important to think about for yourself, why am I going into this field? What is driving me to do so? For me, I have always been interested in how the brain works. From a young age, I was curious and observant and fascinated by why we think the way we do and why we feel the way we do. So the psychology field has always been in my radar. Junior year of college, I was hit with panic disorder and generalized anxiety disorder with a health anxiety specifier, which I will talk about further in another podcast. So I went to therapy and I was just changed for the better. And the therapist really helped me and gave me such great insight. And I realized that I want to help people the same way that she helped me. So I started taking classes at my undergraduate university in the psychology field, and soon my goal to go into the psychology field was secured. Once you have an idea of, maybe this is the field I want to go into, maybe this is a career that I want to have, then my next piece of advice, as you may have guessed, is to take classes at your undergraduate university or college. So this is great to really see if you have a passion for this field, and you maybe find a niche. So depending on the undergraduate university, there could be a wide variety of psychology classes. For example, there are family psychology classes, developmental psychology, forensic psychology, and much more. If you find that you really enjoy these classes, you can think about transitioning to a psychology major. You can also have a double major or think about a minor in psychology, which is what I did. And if you plan on going straight to grad school from undergraduate universities, then programs will look to see that you have some experience and knowledge related to psychology. So a minor or switching your major could be very important. Next, see if there are any research opportunities through the psychology department at your school. This is a great way to get a taste for different populations, see if you're interested in research, see what the needs are in the field, and it also looks really good on a resume. I did research through the psychology department at my undergraduate university, and I did it for about a year and a half, I would say, and it was just a really rewarding experience, and I learned so much. It is also necessary to research what kind of careers you may be interested in. What kind of degree do you need to get to that career? And think about how much time and energy you want to put into it. It's really important also to consider, of course, things like finances and if you prefer online or in-person schooling. So here are some more details on what to look for. Depending on your career of interest, it may require a full-on degree or it may require a certification. So what are certifications? Having a certification means that you took courses or classes to show that you specialize in a certain area of this field. There are post-degree and pre-degree certifications, but there's also standalone certifications that can lead to a fantastic career. Read the fine print to see what the certification that you're interested in entails, and also see if post-degree means that it's post-bachelor's degree or post-master's degree, because that will really determine the trajectory of your schooling. If you pursue solely certification, it's usually less time-consuming and less costly than a master's or doctoral program, which is a great plus. Some of the careers that you can have with a certification include being a life coach, a substance use counselor, a grief coach, a community health worker, a behavioral analyst, a peer counselor, a health coach, case manager, psychiatric assistant, career coach, residential counselor, and much more. Most types of professional counselors that you see in TV shows and movies need a master's or doctorate degree to practice. And if you pursue a master's degree versus a doctorate degree, that really just depends on which area of counseling you want to pursue. You don't need to know exactly what your dream job is when applying to schools, but it's important to have an idea of the path you want to take. For example, do you maybe want to pursue teaching at some point? Do you want to diagnose? Do you want to do solely research or solely clinical work? If you have an idea of these, this will help you determine what graduate program may be the best fit for you. When I was researching this field, I was super confused by the differences between some of these professional degrees. So I knew what the difference was between a therapist and a psychiatrist, but then what is the difference between a therapist and a counselor, or a counselor and a social worker, or a psychologist and a psychiatrist? It was just all so confusing. Here, I will give you a brief rundown of the differences between different types of degrees in this field. So first off, let's go into marriage and family therapist, or an MFT. So that is the degree that I got, and that is a master's degree. It's usually about a 2-year program. And something super necessary that I wish the world knew is that the term MFT is misleading. You don't only have to work with marriage issues and families. For example, you can specialize in substance use, eating disorders, cancer, and chronic illness. You can work in a school. You can specialize in working with children, OCD, and so much more. MFT is social and relationship based. So that is the emphasis. And because of this, it's usually a more micro level degree. So it's based more on the individual treatment unit. The next degree that I want to talk about is a counseling degree, or an LPCC. The difference between MFT and LPCC could be in the emphasis on the program, and it's usually a difference in the courses taken in that program. So it's very confusing, but different schools may have different specifications for the LPCC degree versus the MFT degree. So really necessary to just look at the school and see what those specifications are and if they align with your values and goals. Counseling programs can have different specializations and emphasis as well. So for example, there could be an emphasis in child psychology, in MFT, in ABA, which is applied behavior analysis, and so much more. So it really just depends on the school and the program. The next one I want to talk about is social work, or an LCSW. So social work, it usually is a master's degree or a doctorate degree, approximately 12 months to a 3-year program. Social work involves training in case management, and it's usually more macro level. So it's more seeing systemic issues and also just how our environment and how society affects individuals. So in social work, you can work clinically, but you can also have careers in public health and social services. Something to note is with these therapist, social work, counseling degrees, you do not have to get licensed if you go down this route. Most do, but you can also get a degree and do something else. For example, I know an amazing human who I worked for many years who got her MFT degree but never got licensed, and she now runs a successful private practice that teaches cognitive and social skills. So moral of the story, you can go through these programs, never get licensed, and live life as a person who is unlicensed but has a degree and leads a very successful career. All of the careers that I just mentioned can work in all types of settings. You can teach at a non-university level. You can have a private practice. You can work in public health, in a hospital, in social services, at a school, etc., etc., etc. Next is a psychologist degree. So a psychologist degree, it's a doctorate degree. So it can be a PhD or it can be a PsyD. The difference between a PhD and a PsyD is that a PhD has more focus on the research aspect and a PsyD has more focus on the clinical. So both can teach at university levels, own a practice, do research. They can all do clinical work as well, that like therapists do. Psychologists, and if you have a doctorate degree, they're usually more highly regarded and have higher pay. And an important distinction is that a psychologist cannot prescribe medication. So as I said, this is a doctorate program. It's usually 5 to 7 years. And a psychologist degree can have a specialization, such as a degree in clinical psychology, counseling psychology, forensic psychology, and much more. Lastly is a degree in psychiatry. This is a doctorate degree as well, and so once you complete the degree, you will have a DO or an MD after your name, and a psychiatry degree entails 4 years in medical school and 4 years in residency. And this is because a psychiatrist can prescribe medication. So a psychiatrist is more medication-based rather than clinical-based. As I said previously, more often than not, having a higher degree will allow you more flexibility and opportunities, higher pay, and more clout. But this really depends on the career and, of course, the individual's ambition. Success is subjective, and your version of success depends on your personal levels of grit, motivation, and passion. With all of these traits, someone with no degree can be as high achieving as someone with a medical degree. It all depends. After deciding on what degree you want to achieve, it's time to consider some key factors. First, consider location. Where do you want to live for a good chunk of years? Where will you be able to have connections after you graduate and have opportunities to network? For me, I really wanted to move back to California and be close to my partner and be close to friends and family after being away and out of state for my undergraduate university. Next, consider if you prefer an online versus in-person program. Do you prefer remote or live classes? Do you prefer a campus feel or more of an office building feel? Or do you not care? For me, it was very important for me to have a campus feel. I just love campus life. I love the community of feeling like I'm on a campus. And so that is something I looked for in a school and in a program. Next, and very important, consider cost. Some programs can be way more costly than others. Usually private universities are more, and getting a high degree is not cheap. So this is something that is so necessary to consider. So I recommend looking into scholarships, financial aid, and just applying for anything and everything that you can to help the cost of a higher level of education. Then consider structure and length of the program. So for structure of the program is the practicum or clinical element during both years or just 1 year of the program? How many classes do you take a day? Are you able to work while you're in school? Some programs, especially the online ones, are sometimes shorter than others. Programs that are shorter are usually full-time programs, and those that take a bit longer may be a part-time program, which allows for the ability to work more while in school. Next, consider the reputation of the school or the program. How long has the school or the program been open? Make sure that it is accredited, and you can even check the professor's credentials. Do you also know anyone who attended or considered this specific program? Reach out to them. And you can even look for mental health professionals in your area and reach out to those people to see how they chose their master's or doctoral program. So now a little bit about the application process. You may or may not have to take the GRE. And if you don't know what the GRE is, it's basically like an SAT, but for graduate schools. And I did have to take the GRE when I was applying to graduate school because I needed it for some specific programs that I was applying to. But then, of course, some programs did not require the GRE, so it really just depends. But it seems that more and more schools are finding that the GRE is not representative of your fit to be in a program. So deadlines. There are usually priority and regular deadlines. Priority deadlines are the earlier deadlines, and it seems that most programs have multiple application deadlines. For example, there may be one in November, one in January, one in March. I personally recommend to get in applications in the early round because then you have your interview days early and you find out if you get admitted to the program earlier. I sent my application in immediately and I had the first round of interviews and I realized that I got into the program in December. So that was really, really early considering that some people in my program got in March, but it really is just personal preference. Some programs also have cohorts or classes that start multiple times a year. Most start dates are in early summer, I would say, so around May or June. So see what works for your schedule. For example, if you are an undergraduate currently, then see if it aligns with your graduation date. Or if you're working, see if that works with your work schedule. In the application, usually there are essays you'll have to write. You have to include a resume. Sometimes there's a timed writing assessment, and also you will need some letters of recommendation. So for letters of recommendation, give letters of rec people a good amount of time, approximately 2 months, I would say, to submit the letters of rec. And these letters of rec people can be professors from your undergraduate university. They can be people that you've worked with. It would be great if it's people that you worked with in a clinical or research setting as well. That adds a little bit to your application. But it can also just be people who think that you are wonderful and passionate and are great fit to be in a program like this. And for some interview tips. So for these programs, they really want you to show yourself and be okay with vulnerability and authenticity. It is okay for these programs to talk about your mental health struggles, and they are very, very open to you sharing your personal experiences because everyone has a reason why they want to go into this field, and the people who are interviewing you want to know your reason. Pick a few noteworthy experiences in your life and practice talking about those. Show your passion. I picked a few meaningful experiences that have happened in my life that relate to the psychology field itself or relate to my passion, and I got really good at talking about them. The purpose of this was so that during the interview, I could use those different experiences as examples for various questions that the interviewer may ask me. In your interview, emphasize your experience with research, any clinical experience or work that you have done, and also experience with specific populations. For example, it's important if you're thinking that you want to work with kids, talk about your babysitting job or your counselor job. That is all information that the interviewer wants to hear. It's also necessary to have information about the program. So know the program. Know things that you like about the program and things that you're excited for in the program, and also have some questions about the program. Remember that you are interviewing them too. You are trying to gauge if this is the best program for you. For examples of specific interview questions and more application process information, download my free guide on Just Therapist Things product page on teacherspayteachers.com. This is linked in the episode notes. I hope you found all of this information useful, and I hope it guides you on your journey to be a mental health professional. Thank you for listening to Just Therapist Things. And next week, I will be releasing an episode on a specific anxiety disorder that I have personally experienced and treated. So look forward to that, and we'll talk soon.